Hey, this is Dr. Dana Wasserman, and welcome to Tough Talk with Dr. Dana. And today is going to be a particularly tough episode, and I'll get to why in a second. But first, disclaimer. There's a longer disclaimer below me. Please read it. In addition, I'm legally required to tell you that I'm not providing psychological services and that this isn't intended to treat, diagnose, or cure any psychological issues you may have. I will be sure to honor your questions so that if necessary, you will know better when to seek help. Now, why is this going to be a tough episode? Let me tell you. When I was first considering doing an episode on pre-existing mental illness in the face of COVID-19, I thought, well, I could take a list of the predominant mental illnesses and make a list of them, go through the symptoms, yada, yada, yada. And frankly, that would turn into a real didactic yawn fest. Nobody wants that. Toss that aside. Then I thought, well, hey, maybe I could interview somebody. Maybe I could interview somebody with mental illness. And that person could then explain to me their experiences having mental illnesses and how they cope with mental illness in the face of COVID-19. But then I recognized the potential difficulties of technology, transferring Zoom to Facebook. And then I thought to myself, oh, I can't handle that. That goes way over my head. And even that's not saying much. So I thought about it for a while. And then it occurred to me, well, what about me? I have a mental illness. I'm dealing with the fallout from COVID-19. So why don't I simply talk about my experience with bipolar 2 disorder in the face of COVID-19, which will be a couple-fold. Number one, I will inform you how to deal with mental illness with all the new conditions under which we live, number one. Number two, we're going to smash a couple of good old stigmas here. So I think this will be for a good episode. First, let's talk about bipolar 2 disorder, the disorder that I was diagnosed with only a few years ago, actually after having lived with it for years. More likely, you've heard of bipolar 1 disorder out in the media. That's much more spoken about. There's the Silver Linings Playbook movie about it, brilliant movie. There's another movie about it called Touched with Fire, really beautifully done. You have the actress Carrie Fisher, who played Princess Leia in Star Wars, who lived a life and was very vocal about her experience with bipolar disorder, in addition to Margot Kidder, who played Lois Lane in the Superman movies, who had a tough existence living with bipolar disorder. Then you have Halsey, and then you have Bebe Rexha, and etc. People are becoming much more forthcoming about their experiences with bipolar disorder. So why don't I tell you about the differences, between bipolar 1 and bipolar 2 disorder, okay? First of all, they share a number of symptoms, and let me share some of the symptoms with you, okay? First, it's an elevated or irritable mood. There's your mood disturbance and a very high level of activity and or energy that lasts for at least a week and present most of every day. There is excessive grandiosity and very high self-esteem. That would be inflated self-esteem, actually. Little need for sleep, racing thoughts, extreme distractibility, increased goal-directed activity. And what I mean by that is you hook onto an activity and you just run with it, whether it's something at work or something at school, or increased non-goal directed activity, which could be sort of frenetic pacing or just this bundle of energy that you don't know what to do with. And lastly, becoming far too involved with potentially risky activities. A common example is, say, someone who spends thousands upon thousands of dollars on their credit card under the guise of a single weekend, or becoming involved in a series of risky relationships, or becoming involved in a number of risky business prospects. Okay, those are the similarities between bipolar 1 and bipolar 2. Differences now, this is important. With bipolar 1, the symptoms are severe enough to which that the person is significantly impaired at work, like you're getting fired from your job, or at school, maybe you can't handle school, or the symptoms may necessitate hospitalization. The person might cease being safe with him or herself. Or there might be psychosis, and psychosis is a break from reality, which manifests typically as hallucinations or delusions. Delusions being false beliefs, hallucinations being either hearing or seeing things that are not really there. In hypomania, a hypomanic episode, which are the episodes that I had, interestingly, even when not symptomatic, there's a change in functioning that people can notice, even if they cannot necessarily articulate. But the episode is not severe enough, interestingly, to cause a severe impairment in work or at school. Like I might not get fired from work, which I wasn't, or I might not get kicked out of school. It does not necessitate hospitalization. This is the hypomanic episode, remind you. And there's no psychosis. Then with both of these episodes, there are dips into depression. And then we typically know what depression is. Well, it's a sad or depressed mood every day. And then we have fluctuations in appetite, fluctuations in sleep, lost interest in activities you used to love, trouble with sleep, I already said that, feeling fidgety or moving too slowly, and you're feeling sluggish, excessive fatigue, and then it gets a little darker, feelings of worthlessness or excessive guilt, trouble with thinking or concentrating. And then you get to the place of really, really dark thoughts in which if you have them, then it's time to ask for help. So when it comes to depressive episodes, anecdotally, or at least mentioned in the DSM-5, which is the Diagnostic and Statistical Manual, of which all psychologists and psychiatrists refer to for diagnosis, people with bipolar 2 tend to last longer in depressive episodes than they do manic episodes. And that was my experience. I had one hypomanic episode in which I fit many of the criteria that I described before, and was wondering why I was losing friends, and was wondering why I became obsessed with various projects and various things to the exclusion of everything else, including my family. And then I crashed horribly hard, and my first depressive episode landed me in the hospital for the first time. And it was the first of 4 times. And then after that 4th time, I spent time in a halfway house. We can go into detail more about that, because I think speaking about hospitalization is important to smash that stigma, because lots of people don't want to talk about that. There's a lot of shame about being hospitalized. Well, I plan to break that today, and I will. So how am I functioning right now during this? I'm actually functioning fairly well. I think importantly that I'm on a steady set of medications that I keep up with. I exercise every day. My sleep is definitely disrupted. I'm having those incredibly weird quarantine dreams, but I have to be careful because I know disrupted sleep can be a trigger for a hypomanic episode. Sometimes I feel down, but I think feeling down is normal, actually, during this isolation. And I talked about that during my first talk on isolation, that it can be rather depressing being stuck inside when it's beautiful outside all day, and yet you still people walking around out there. But for the most part, I'm okay. And once in a while, I might buttress up against a particular mood state and then fall back down. So it's more like this rather than like this as it used to be for me. So thank God for that. And please feel free to ask me any questions about my experience with bipolar 2, because there's likely so much that I'm missing here. So how can people with mental illness best cope during COVID-19? Well, I think we all know that the days seem to blend together. And I too am one of those people who has to look at her phone to see what the date is and what the actual day is. And for people like me who take medication, if you don't take medication, I respect you for that too. But for those of us who take medication, it is incredibly important to keep track. You don't want to double up on a dose, and you certainly don't want to miss a dose. Who knows what kind of side effects that might bring? Ask your psychiatrist. I'm a psychologist. So that's really, really important to keep track. And you also don't want to wake up one day realizing that you've run out of medication. Although my experience has been that if that has happened, and that did happen to me once, my pharmacist has been incredibly understanding about filling a prescription that I last minute forgot about. Let's see. Keep routines that work for you and modify the ones that fit your new reality. So let's say if you go to sleep at 10 o'clock every night and you wake up at 6 in the morning, this is what you would do for work, let's say. Don't change that during COVID-19. Try to keep that routine going. It's very, very important to keep your sleep as stable as possible. And just because you may not be going to work doesn't mean you get to sleep until noon and then stay up till 4 in the morning binging some new Netflix series. And I know that doesn't sound entirely bad to me, but trust me, don't do that. If you have to adjust your routine, so an example of that would be, let's say you were used to going to the gym a couple of times a week, and now of course gyms are closed and you can't do that. It's so easy to find a home workout. In fact, we have the inimitable Lindsay G right here from the Stigma-Free Toolkit, who does a wonderful job doing a home-based workout Mondays at 10 o'clock. So there's a plug for you. I highly recommend it. It's fun and you really get a good sweat going. This is important. Reach out, reach out, reach out. I, for one, am particularly terrible about this. Because we are physically isolated does not mean we have to be socially isolated. And it's really important that you call or video chat with at least one person per day to keep you connected and to keep you from getting isolated and caught within the maelstrom of your own thoughts. And I mean that for everyone, not for just people with mental illness, but for those of us with mental illness, I think it would be helpful to just be able to sort of let go and talk with others and laugh and recognize that there's a world outside of our small homes right now. If you have a therapist, don't stop now. It is so important to keep that momentum going, especially in the face of these stressors that we live under with COVID-19. So let's say you've been seeing your therapist weekly for a couple of years and suddenly their office closes. Find out if they do online therapy. And if they do online therapy, then maybe they can refer you to someone who does, even if it's temporary. It's so important to keep that going and have that support through this really challenging time. Utilize crisis support lines if you need to. Don't hesitate to use them. They don't just sit there waiting, to lay dormant. It's important that if you are feeling like you're at risk or that you are in crisis, to give them a call. And luckily, in the Stigma-Free Toolkit in the Help and Resources section, you can access them. There's a suicide hotline. There are a number of hotlines there that you can access that will get you the help that you need. Now, this is interesting. Next, you can contact what's called, and I've never heard of this before, a warm line. And a warm line is simply a peer support line, just people that you want to talk to. Maybe you don't feel like talking to a family member, maybe you don't feel like talking to a friend, but just someone who's just objective enough to listen to you and you're able to feel comfortable just sort of spouting whatever you need. I know there's an app that goes with that, and if people have interest, I can list that in the comments below after my time ends today. I want you to be mindful of your triggers. For me, a big trigger of mine is Facebook and getting involved in erstwhile political and social arguments. I can become incredibly caught up in the drama that is fomented by people posing various viewpoint, and I can get really agitated. And so if I'm not careful, I can get to kind of an unpleasant place. So I can jump right to the next one. Limit your social media use. I give myself about an hour, I'd say, maybe even 2 hours of just putzing around on Facebook. But if I find that people are posting things that I'm finding increasingly upsetting, I have to get off. And that's for my own well-being. And I suggest that for you too, that if you find that being on social media is becoming upsetting, or you're getting involved in arguments and it's really winding you up, or you're looking on Facebook and you see all these perfect pictures of people with their perfect lives and perfect children and perfect dogs, I can get depressed by looking at that too. I know it's time to shut the lid on my laptop and go cook myself a good meal. Be mindful of your sleep patterns. This is really, really important, not just with people with bipolar disorder, because disrupted sleep can be real sensitive to those with bipolar disorder 1 and 2, but for anyone. And I talked about that before, by keeping good sleep hygiene. And perhaps most importantly, manage your stress. Those with mental illness are more susceptible to unstable moods and stressors. So it's really important that if we are stressed out, that we know how to take care of ourselves. And for example, let's see, if I'm really, really stressed out, like here's an example. I had some technological difficulties before I started this talk today. And I was getting really, really upset because I did not know how to fix this. I had to get some assistance from my husband how to fix this. But it ramped me up and I could feel my heart thud, and it was very unpleasant. So I had to sit there and do some deep breathing in order to just calm my physiology down. Did it work perfectly this time? Yeah, I'd say for the most part it worked pretty well, but it wasn't perfect. I was still pretty nervous by the time we first started. But I knew that rather than prepare more for this talk, I found it important to really just sit and relax and not have this turn into some kind of agitated moment that's going to be harder and harder to bring myself down from. So that's it in terms of what you can do to manage your stress if you have a pre-existing mental illness. And I hope I've also shared some of my own experiences with bipolar 2 disorder. I'd love to take some questions now, if you have any. I have about 10 minutes, so let me take a look here. Oh, here's a fantastic question. Oh my gosh, I love this. What if someone displays all of those behaviors to an extreme and hasn't had a formal diagnosis due to privilege? How do we help those people? You know, the first thing I think of is, for example, when I worked in San Francisco, we did have free mental health clinics, and I don't know if they exist here, but we took in people who could not afford anything, and we were able to get them set up with both therapy and medication if need be. So to be quite frank, this is a question I need to think more on because I don't really know how it is run in Canada, having lived here only for a couple of years. But I think the best thing we can do in the meantime for those people who are not currently stabilized is to really listen to them and support them, to not invalidate them, to not minimize their experience, and that know that we will do everything we can to help them. I hope that's a helpful answer to you, but I don't feel like I'm finished with that one yet. How do you know you've been diagnosed properly if you've had a life of trauma from birth to adulthood and have never had a sense of normalcy? Oh my gosh, these questions are fantastic. I'll speak for myself here. I knew I was correctly diagnosed with bipolar 2 after a good 25 years of being diagnosed with depression. Was my diagnosis wrong with depression? Not necessarily, but I think later on, for some reason, these new behaviors cropped up. When I was then presented with therapy, and for me, the right medication, which I know isn't for everybody, and I respect that, as I've said, um, I knew I had fallen upon something. That this is it. This is the right diagnosis for me. But you have to remember what diagnoses are. They are abstract constructs, and even though they've been supported by thousands of empirical studies, I still think they don't take every consideration into uh, effect, such as if you have had trauma from birth to adulthood, how do you differentiate that from normalcy, and then how do you find that normalcy? At some point, I have to ask myself as well, how do diagnoses really help? And can diagnoses actually be limiting? It's something that we all need to contend with. And I do agree, medication doesn't work the same for everyone. We are all unique. This is precisely why I do not ever talk about the medication that I take, because the medication that I take may be very inappropriate for somebody else. I just know that what I take works for me, and that if you are not for medication and then you find other ways that work for you. As a psychologist, I believe that wholeheartedly. If I work with someone and that person doesn't want medication, then God bless them. I will support them in any way I can. And I believe that personally as well. There may come a time in which I may not need medication. And if that's the case, I'll take it. But if I do need medication now for the rest of my life, let's say, I'll take it because at one point it saved my life. Okay, let's see. What are some tips people can do to keep sleep on track? Okay. Keep a sleep ritual before bed, and even keep a an awake ritual when you wake up. Um, I like to suggest, and I try to do this for myself, but I admit I am not always successful because I get caught up in like really bad reality TV, and that's just not good for anybody. So I suggest that you have something that you even write out, like I don't use any kind of blue screen 2 hours before bed. I take a nice bath or a hot shower. Maybe I put on a nice bathrobe or what have you, or a nice soft blanket and play some soft music and really prepare yourself for sleep. And then I would have an alarm clock on and I would try to wake up at the same time as best you can every day. Even though I know it's difficult if sleep is disrupted, if you can try to get up at the same time every day, then that's definitely worth it. Let's see. Most restorative sleep is between 10 p.m. and 2 a.m. 10 p.m. ideal bedtime. I buy that. I could do a little better with that, but I buy that. That makes absolute sense to me. Have you faced stigma in the past because of your diagnosis? What is your advice about dealing with this? Well, that's a great question. Today is the day I am most open about my bipolar disorder. Um, I do have a video in the Stigma-Free toolkit about my story with mental health, but I've been very quiet about it. Um, Most likely because of my career and the impact that a psychologist who works in the mental health field, who works to help better people from their issues, has a fairly significant mental illness herself. I did face stigma um, indirectly, and let me explain that to you. When I got out of the hospital for the first time for a depressive episode, I was thrilled to get out, and I was just ready to start my first private practice. And I had spoken to a colleague of mine whom I really respected, and I still do respect, because she told me some harsh truths when I told her that I had been very, very ill and I had been in the hospital and for a depressive episode. She had warned me in no uncertain terms to never say anything to anybody because nobody will refer a client to me again. That was crushing. I thought, this is my own field now, and you would think there might be a little bit more understanding or empathy, but she said this is the truth. I don't begrudge her for that. I appreciated her honesty, but that stung, and that kept me quiet for years. I won't lie. I didn't talk about it very much, and this was more during my uh, days of depression and before a bipolar 2 diagnosis. But that was very, very hard for me. Let's see. Oh, how do I advise dealing with this? Well, I'm hoping that by my example of coming forward and speaking so frankly about bipolar 2 disorder, that we can learn to speak our truth. The fact that I've been hospitalized 4 times and spent a couple of weeks in a halfway house learning how to function again, as long as I talk about that and sort of suck the stigma and the shame out of it, and it was just simply another life experience that I have. So I say speak your truth, but I won't lie and say there might not be um, there might not be this is a tough one for me, that there might not be fallback from it. I don't know. And I can't just say, everybody just come forward. You have to come forward on your own terms. And you have to do what's right for you. And frankly, that took me a couple of years. And during this time, working for a Stigma-Free society, it's taken me a couple of months to get the guts to do what I'm doing today. Here's another one. All right, here we go. Are people who struggle with drug addiction usually self-medicating due to real brain health issues? Oh, what a great question. I do think that people who struggle with drug addiction are usually self-medicating. Is it just brain, or is it environment? Is it just nature? Is it just nurture? I tend to think it's both. I think some people might be more biologically predisposed to drug addiction than, say, others. And there are others who may go through the same terrible environmental events and never touch a drug to begin with. So that's a touchy situation there, but it's a great question nonetheless. Watch who you follow. Unfollow is your friend. Yeah, very good point. Let's see. What if you have extreme stress and don't have the option to manage stress? What then? Well, I think it depends what you mean by you don't have the option to manage stress. I'll use myself as an example. I think it's really important by even having just a few minutes to yourself to decompress, to, I have kids, to shut the door to the bathroom and just take a couple of deep breaths and relax my muscles and do what I have to. So maybe it's sort of a do what I have to phenomenon. I know we're all incredibly busy, even though we're at home, isolating, and that we're working hard for those of us who are parents to try to homeschool our kids, which is a stressor unto itself. Even those of us who don't have kids have our own sets of stressors. Just try to grab every minute that you can and either do a stretch, a breath, a reminder that you are a decent, good human being and you just need to lie low for even a few minutes. That's a great question, though. Let's see if I have any more here. Let's see. Let's see. Here we go. Okay, I have a couple more left here. I'll see. Once you have a diagnosis, how do you let people know you're human with human emotions when they try to say all your reactions to stress are mental illness? Well, that's a great question. I typically tell them as such. And sometimes I have to actually think about if I have some really extreme reaction to something. I usually kind of pull inward and go, okay, what was that about? But I just simply try to inform people uh, that no, this is simply just a reaction to stress and nothing, there's nothing more. And with hopefully enough didactic presentation to them that they'll be able to get it. But not everybody will. Not everybody understands mental illness, and I think that can be really, really difficult to live with because not everything is bipolar 2. Not everything is a potentially hypomanic episode. But don't get me wrong, I I question myself sometimes. Wow, what was that? Wow, I just got really obsessed with that for a day or two. And it's a little scary, but I think ultimately, if I have the ability to introspect about it and to come down about it, I know I will be okay. And all you can do is to, you know, inform people and teach people as best you can, and then you have to simply let it lie. And I think that's really tough and unfortunate. Let me see. All right, last one. What is a mantra or affirmation that you find helpful in your healing? Oh, that's that's really good. I have a I have a couple of them. I think the most important one is that I am safe, I am good, I am okay. And I have to breathe during that. And I usually say, I am safe, I am good, I am okay, um, during a time when, uh, I'm particularly worked up about something, or if I've made, some kind of crappy mistake at work, especially, and I'm really down on myself. And I can begin to feel myself spiral into perhaps, is this a depressive episode? Uh-oh, I hope not, because that does not end very well. I am safe, I am okay, I am good. And I remember that I'm a good person in spite of my life's errors, and there are many. So, well, it looks like we are out of time here. So I want to thank all of you for your amazing questions. This has been a really great episode, and I'm very, very happy to have shared my experience with all of you. And I want to wish you all the best. Until next week, this is Dr. Dana Wasserman with Tough Talk with Dr. Dana. Bye bye now.